I am Dr. Gutta Srinivas, urologist at Star Hospitals, Hyderabad. Today we will be discussing about cancer of the prostate. The incidence of cancer of the prostate is on the rise. All along we have seen increased incidence of these cases in the Western society, but of late even in the Indian society we are seeing good number of cases every day. So there are no definitive causes for the increase in the cancer, but it is believed that certain change in the dietary habits, food habits, excessive intake of meat products can lead to increased incidence of these cancers of the prostate, and healthy lifestyles can decrease this increased incidence. Patients with enlargement of the prostate with prostatic cancer will present with increased frequency of urine, urgency of urine, urge incontinence of urine, discomfort while passing urine, the need to pass urine several times in the night, and poor stream of urine, interruption of the urine stream, incomplete evacuation of the bladder. These are the symptoms they present with, because this enlarged prostate will block the urine outlet and can lead to all of these problems. A patient, when he presents to us, we do urologist an examination called as digital rectal examination. This will tell about the size of the prostate gland, about the nodules in the prostate, about the hardness of the prostate. When a patient presents to us with these symptoms, in our examination, the most important valuable examination is digital rectal examination. In this examination, we examine the prostate gland and try to identify the size of the prostate, and also look for any nodules in the prostate, and also look for the consistency of the gland. Normally it should be soft. Now the minute it becomes very hard, rock-like, then we have to think that there is some abnormality in this. After doing the digital examination, then we'll be asking the patient to get a blood test called as serum PSA. Any rise in the serum PSA, we should suspect cancer of the prostate, and we should further proceed to other investigations. An ultrasound abdomen will reveal if there is any enlargement of the prostate and its effect on the urine bladder and on the kidneys. Normally, at the end, once we suspect that there is a possibility of cancer in the prostate, we do a test called as truss-guided prostate biopsy. This biopsy will tell us whether the patient is having cancer of the prostate or not. All cancers, they can be identified at different stages, early stages and late stages. Whenever a cancer is just confined to the prostate gland only, without extending to the other structures, it is treatable. You can completely cure the patient of the disease. So a patient who presents to you very early in stage and you diagnose at a very early stage, we can give him a complete curative treatment. The present day we have very advanced treatment modalities available for curing cancer prostate. We call it as surgical and radiological treatments. Surgical therapies are radical prostatectomy, laparoscopic radical prostatectomy, robotic radical prostatectomy. Essentially here we go and remove the entire gland of the prostate along with the cancerous tissue, so that the patient is completely free of the disease. In some of the individuals who are not fit for a radical surgery, then we would suggest what is called as radiotherapy. This is also very effective in curing cancers of the prostate.